I'm having a great response to my daily pill, but not everybody is so fortunate.
Nearly 4 years ago, Bev Moyer was diagnosed with stage 4 lung cancer and told she had up to 3 years to live. A shocking diagnosis, as Bev has never smoked. Luckily, the oral take-home cancer medication she's been taking has been effective, but she says not everybody has access to this type of treatment.
I'm over 65. It's covered. It's approved in Ontario. My heart goes out to the people who are younger, and people as young as 30 are being diagnosed with lung cancer. They're still working. They haven't accumulated their retirement savings. They may still be raising their children.
But that's an issue that's really specific to Ontario. You go in BC and you take the same prescription that Bev has, you can then get it all covered. But as you move east in Ontario, we can't get 100% of our oral take-home medication covered.
And if you don't have insurance, the price can be crushing, even for just 1 month's worth.
It can be $6,000, it can be $10,000. But if the government were to add that to their budget, it'd be less than 1/10 of 1% of the current healthcare spending in Ontario.
It's one of the major issues being highlighted by advocacy group Cancer Action Now. As the country's premiers meet in Halifax for their annual conference, the alliance of more than 40 organizations is urging them to address what they say are major gaps in cancer care across the country.
We must ensure that the treatments that are available to everybody across the country. And that's not the case now, because each province makes its own decisions about which drugs it will cover and which it won't.
And it's not just equitable access to medications, it's faster approvals as well. In a statement, a spokesperson for Premier Doug Ford, who will take over as head of the Council of the Federation in August, wrote in part, "Currently, patients in Canada wait almost 2 years to access life-saving breakthrough medicines, a year longer than in other developed countries, placing us last in the G7. As Premier Ford takes over as chair of the Council of the Federation, one of his focuses will be doing everything possible to give Canadian patients the same timely access to life-saving treatments as patients in the rest of the world. This year's meeting of all 13 provincial and territorial leaders is set to wrap up on Wednesday. For City News, I'm Erica Natividad.